Hello and welcome back to another episode from Driving Britain. Today we're going to be comparing the British NHS against the American healthcare system.
10 grand for a baby.
Is there a price for that?
Yes.
Cute little accents.
$100? $200?
$2.5 grand.
$80.
600.
250.
Everybody's mouths are all like,
Shut the fridge.
shut the fridge. Shut the fridge.
$600. $600.
Oh, it's like funny at first, and then it's really sad.
Call out how much do you think that costs?
Zero payment.
Okay, I'm not going to lie to you, this is going to be one of the most emotional videos you've seen in quite a long time, and by the end of it you're not going to know which way is up, because if you live in the UK you're going to be devastated to hear how people in the US are surviving and what they're exposed to on a daily basis when it comes to healthcare, something that people in the UK take for granted every single day. Now, if you live in the UK, you will know that the government have tried many times over the past 20 years or so to sell off the NHS and to make the UK a private healthcare system, basically getting everybody to take out private health insurance in the place of the NHS, which is the system that America has. Most people in America have been trying to get their system to change to be more like the NHS. So that makes you wonder, which one's best? If America would prefer to be more like the NHS, and the British government would like us to be more like the US, which one's actually better for the people? To help us understand what it's like in America, we're going to be looking at a video from an American ER doctor. His channel is Dr. J Mack and his link is in the description. The doctor in this video has worked in different types of hospitals, ones where there's more money available and ones where there's not. He knows what it's like to be an American with the current healthcare system, and he knows it from both sides of the story, because he's living and breathing it every single day while he's working, trying to save people's lives, while he's trying to make people better. He also knows it and has experienced it as a member of the United States public. When he's at work, he's a doctor trying to save lives. When he's not at work, he's just the same as every other person in America. In America, if you fall down in the street and you found an ambulance, that can cost you up to $3,000. In the UK, you fall down a curb and you sprain your ankle. You don't think about phoning for a taxi to go to the hospital, you just phone 999 and an ambulance comes and picks you up with 2 qualified paramedics and they take you to a hospital where you're then fixed for free and sent on your merry way. In the US, if you fell down that same curb, you would have to pay $3,000 just for the ambulance pickup, which is going to have EMTs. The sort of training that a firefighter in the UK would have is the sort of training that an EMT in the US have. There are paramedics working in the EMT and in ambulance type roles, but most American healthcare providers on that emergency service are EMTs, medical technicians, not paramedics. Now in the UK that's a really big distinction. So in the US you're not getting a fully qualified paramedic, you're getting somebody extremely skilled and they're most likely going to keep you alive long enough to get you to the hospital because it's what they do every single day. But in the UK you're going to be getting a paramedic or a doctor on the spot, depending on the severity of why you're calling them. If you break your shoulder, crack your collarbone or something like that in the UK, something where there's not really any treatment for it, you're going to go to hospital, you're probably going to use an ambulance to get there, you're going to have an x-ray, and then you're going to go home with a pocket full of painkillers. In the US, to do that same thing, you'd pay up to $3,000 to get your ambulance, you'd pay up to $9,000 for your x-ray, and then you'll pay hundreds and hundreds for your painkillers. How much do those same painkillers cost you in the UK? The price of a prescription, what's that now, £10.50? The differences between the NHS and the US healthcare system are literally like black and white. They are so different. Now in the UK this is quite hard for us to understand because we also have private healthcare in the UK. But the thing is, because the NHS is such a good system in the first place, private healthcare has to be so much better to encourage people to be their custom. If you have an operation under private healthcare, you're likely to have that operation in an NHS hospital with the same doctor who's going to be working for both the NHS and as a private healthcare provider. Because for main operations in the UK, being private just means that you will cut the queue, you can jump the queue. But you're likely to have the operation in the exact same hospital by the exact same surgeon. For minor treatment, you can get that done at a private hospital, but main operations, private hospitals can't perform them because of insurances and stuff like that. They take you in a private ambulance to an NHS hospital and then run the operation there. So basically, private healthcare in the UK, you have a fridge in your room and you get a private room, you cut the queues, things like that. In the US, healthcare is like that kind of anyway. When you go into hospital, if you're admitted for an operation, you're going to be in a room on your own, you're going to have a mini fridge and all the rest of it, because it's already private healthcare. The NHS version means that you're on a ward, perhaps with other people. You're not going to have a mini fridge and you're not going to have a carpeted waiting room for people with a free coffee maker. But our idea of private healthcare in the UK is all of the NHS plus some. But that's not the reality in the US. Private healthcare means if you did fall down the curb and you fractured your shoulder, your collarbone, and you had to have that $9,000 x-ray, you're likely to have to pay at least $5,000 of it, and the insurance will probably cover the $4,000. Because just like with your car insurance, the insurance company have an amount that you have to pay out to start with before theirs starts to kind of kick in, and that's provided they cover you. And in most circumstances, with a lot of people in America, they just aren't covered. They try to claim, but they're just not successful. Now this is going to be an emotional episode. You are going to hear things in this video that are going to make you really question the societies that we live in. And if you're in the UK, you're going to be realising just how lucky you are to have the NHS. If you're living in the United States, you already know the problems with your system. But you probably don't realise just how bad they are compared to most European hospitals, to most European countries. And when I say European, I know that the UK is no longer in the EU, but we all have very similar healthcare systems. In the US, the first question they're going to ask you is, who covers you? Who's going to be paying the bill?
Hey guys, I'm Dr. J. Max Slaughter. I'm an emergency medicine doctor here in the US, and I'm about to react to people in the UK reacting to healthcare prices in the US. And away we go.
10 grand for a baby.
Is there a price for that?
Yes.
Cute little accents.
$100? $200?
$2.5 grand.
$80.
600.
250.
Everybody's mouths are all like,
Shut the fridge.
shut the fridge. Shut the fridge.
$600. $600.
Oh, it's like funny at first, and then it's really sad.
Call out how much do you think that costs?
Zero payment.
Zero payment?
Yeah, zero payment.
No. It costs $2,500.
For real?
Yeah.
Oh, okay, cool.
you look. An inhaler.
$100.
Yeah, you're pretty close. It's a bit more.
120
250 to 350.
for an inhaler.
So an inhaler for somebody that's asthmatic, you know, the blue inhalers, the pink inhalers, these see people using quite often. $200 to $300 per inhaler. If you live in the UK, how much did you pay for your last inhaler? How many inhalers have you got just knocking around the house to have a little bit in? But you thought, it's getting a bit empty, I'll just get a new one. And you just put in a new prescription for a new one without giving it a second thought. You're paying $200 to $300 per inhaler. Would you have so many? Would you even want to use it?
Yes.
Man, so if you're poor, you're dead.
I know that it's like
Dude, I have to pause it right here. Honestly, like, I thought I was going to watch this video and this was just going to be like really funny and stuff. And it was, you know, and it is. And the reactions are like, oh, what? That's crazy. But the realistic aspect of this is that healthcare is a right, and they know that, and they accept that, and they know that it doesn't just belong to one class versus another class. They're keenly aware of the fact that every human being has a right to medicines that are going to keep them alive, especially when they can be cheaply produced at scale, and our industries choose not to do that, to be able to control supply and demand, to be able to control the prices. And okay, yeah, that's not just like the happy-go-lucky video I thought I was gonna watch.
He's got a good point, and he's right. It shouldn't be something that we should be shocked at. And if you're in the UK, you're going to be really, really shocked right now. Or even if you're in somebody in Europe, because you're the same as us here in the UK. You would never imagine paying $300 or an equivalent for an asthma inhaler. How much is in those? About 10 mil, 8 mil? You would be scared to use it. Think about how much money you have left at the end of the week. Now imagine you need a new inhaler, $300. Oh, I know what you're thinking. You're thinking, well, that's what insurance is for, isn't it? That's why you have your healthcare insurance. The problem is, more often than not, healthcare insurance won't pay out. And when they do, there's an amount that you have to kind of pay yourself before theirs starts to trigger. Just like your car insurance, most people have, £200 excess or £500 excess on their car insurance. That basically means that you cover that amount before they start to have to cover the cost. And you can bet that your $300 asthma inhaler doesn't come anywhere near the price that they're going to be looking at before they're going to start to contribute towards it. Sure, you might be able to try and buy a year's worth in one, assuming that the expiries are good for that. And that's assuming that the insurance company are going to let you do that. And do you think they're going to let you do that?
All right, let's keep going.
In the UK. In the US, fortunately, I'm able to get healthcare through my parents, their jobs, but I carry an EpiPen, and I know that the cost of that has just been rising. So there's very few companies that even compete, so it's sort of like a monopoly for the EpiPen. Even though we have insurance, it costs my parents about a couple hundred, even with insurance.
So 2 EpiPens, how much do you reckon they are?
$80.
600.
$40.
$600 for 2 EpiPens. If you've got an allergy, a nut allergy, or if you're gluten intolerant and you have a wheat product and you start to get a reaction enough so that you have to use your EpiPen, hundreds of dollars for life-saving medicine, that is just disgusting.
Dollars?
I'm afraid not.
More?
More?
$100.
More.
$150.
More.
$250.
More.
Shut the fridge.
The lady keeps saying,
$300.
shut the fridge.
$600.
Yeah.
What? Why?
I'm going to stop here.
$600.
So, for those of you not familiar with what an EpiPen is, so an EpiPen is basically a device that has epinephrine, one of the oldest...
Emergency room doctor rant incoming.
This is Dr. J. Max Slaughter warning you that there is going to be a very passionate rant coming up. If you would like to continue the video, watch my reaction, and skip ahead, you're not going to hurt me too badly. Treatments in the book, in medicine. One of the very first treatments that we had available to us, that we are absolutely able to produce at scale for very little money. And it's in a device where you hit it against your leg and it immediately delivers the medicine into your muscle. And this is for people with life-threatening reactions. We're not talking about some sort of medicine that's going to enhance their ability to think better and run better and jump higher or something like that. This isn't some snake oil salesman-y thing. This is a medicine that will take somebody who is on the verge of death and keep them from dying.
So a product that costs a couple of pounds to produce, they're selling for hundreds of pounds. What did he say? $600 for 2? $300 each? The same as the asthma inhalers. Without an EpiPen, you will die if you're having that big a reaction. There is no question about it. They are life-saving medicine. And it's an emergency medicine. If you're one of them people that's having a reaction, your mouth and your throat is swelling up, you really don't have very much time. You need to do something very, very quickly. And that's what an EpiPen is for. If you're from the military, you'll know those same type of syringes. It's the same thing as what you get with your morphine. And every single soldier has a couple of those issued to them with a kit. And nobody thinks twice about it because they're so cheap.
And the fact that the US healthcare system treats this identically to some medicine that can somehow enhance your life is disgusting, is really revolting. And a few years back, there was a lot of backlash against the US healthcare system because this EpiPen that's delivering this life-saving treatment for a very common reaction, which is basically just an allergic reaction. Some people get very, very severe allergies. We have a lot of issues with peanuts here in the US. And actually part of that is because we're also worried about peanuts. We don't expose our children to peanuts at a very young age. I'm not saying everybody go out and expose your kids to peanuts at a really young age, but we've done studies in other countries where they barely have any peanut intolerance. They barely have any peanut allergies. And it turns out in these countries, all the kids eat these little snacks. It's like a little honey snack, I believe. I forget exactly what country it's in. but these little honey snacks have peanuts in them. So they're exposed to peanuts at a really young age without anybody kind of being aware that like maybe they shouldn't do that. And because they are exposed to it at a young age, their body identifies that as something that's not necessarily harmful, that they don't need to like freak out about. But in the US, because of our aversion and our anxiety about these peanut allergies, we don't end up exposing our children to peanuts until they're at this older age. And by then the body's already like, foreign invader, attack, you know? And so they need these EpiPens throughout the US to reverse this life-threatening issue for...
And don't forget, we're not just talking about allergies towards nuts. There's so many people suffering with allergies nowadays because of stuff that we put in our foods, because of pesticides, herbicides, peanuts, gluten intolerance, and basic things like that. That seems to be quite a big thing at the moment. You'll see a lot of gluten-free food advertised on a lot of shelves. It's getting quite big. It's because people are avoiding wheat because they're getting reactions from it. Sometimes it's basic stuff like bloating, but other times it's full-on really serious reactions. But if you go anywhere that's got a comprehensive list of the different allergens in their foods or things that they try to guard against, you'll see that there's a massive list of very common allergens, things that give people an allergic reaction. Those are the very people that need the EpiPens, because yeah, they might not use them and they hope not to use them, but they might have to use them. And if $300 is your entire week's money, how do you pay for your rent or pay for the kids or buy food and buy the EpiPen? You just don't, you just go without. And what does that lead to?
For children to adults, and instead of that life-saving treatment being $10, $15, $50, even $100 is like, all right, like I'm sure you're making a pretty good profit off of this little plastic thing with this little tiny metal needle and this cheap medicine inside. But no, they just keep going, and it hit absurd prices. They said $600 in the video, but at one point I know that it was higher because I would have these discussions with my patients like, you need this. You absolutely need this, and you have to go online and you have to figure out how to get this for cheap. So instead of it being obvious, the US healthcare system is this maze to where there are different ways to kind of hack the system and to get, you know, better insurance coverage or getting things covered by the state somehow through some special programs, or going through different websites like GoodRx. By the way, I recommend that everybody go to GoodRx, GOODRX, letters rx.com. And what it does is it basically shows you the different prices that you have at all the different pharmacies in your area. And it's actually cheaper a lot of times to you to buy out of pocket than it is to go through your insurance, because they want to up the price for the insurance and get as much money out of the insurance company as possible. But then guess what the insurance company does? Oh, you're responsible for paying X amount of this. And when that percentage is higher than just the out-of-pocket cost, that's when these prices just get absurdly inflated for the US citizens themselves. And that's
what I was talking about with the excess, like your normal car insurance excess. When he says out of pocket, that's what he means. The excess, the amount that you have to pay before your insurance starts to cover the cost. And they purposely set that high enough so that they're never really going to, unless you need something major, they're never really going to have to worry about paying you any money. And if you do need something, well, not paying you, but paying the hospitals. And if you really do need something, a proper operation, then they're going to try their best to not honour that agreement anyway, because they're an insurance company and that's what they specialise in. Insurance companies don't specialise in providing care, they specialise in making money. But it's not just the insurance company, is it? Yeah, they are the big bad guys in this, but the companies producing the medicine, they're the real bad guys, aren't they? $300 for something that's costing them less than $10. A life-saving medicine that's only used by people that need it in an emergency. It's not something that you're going to take. It's not like a spray tan or to get your nails done. It's something to stop you from dying from anaphylactic shock right at that very moment because you've come in contact with peanuts or been stung by a bee. $10 product for $300, $400. That's the system that they want in the UK. With private healthcare insurance, with private companies controlling your health.
That's actually this game that just keeps getting played over and over and over and over again in the US, is hospitals are asking more from insurance because they know that insurance is going to deny X amount of the payments. But then guess who gets stuck with that bill? And it's the same thing with drugs. Drugs are charging X number of dollars higher than they actually would need to, because insurance is going to fight this fight and use delay tactics and only cover X percentage of it. And again, who loses? Who loses every single time? The US citizens. The middle class, really. The upper class might be like, whatever. The lower class has, I shouldn't even say lower class. The lower socioeconomic people have more safety nets in place. We have the Medicaid system, which is essentially, government provided insurance. And that's one safety net for.
A UK comparison to get an idea of what he's talking about is like the way that dentists work with the UK, with the NHS. So if you're on a low income or not working, then you can go to an NHS dentist, and it means that the cost will be covered for you, or if you do have to pay something, it'll be a very small capped amount, but usually you won't pay anything. Like with eye care, when you go to the opticians, if you're of low income or not working, if you're on benefits, then you get your glasses and that sort of stuff for free. Or maybe you'll have to pay a small amount towards the frames, but you'll essentially not really pay anything, or certainly not as much as what you would if you just walked in off the street as a regular person without declaring any money issues one way or the other. And the same if you're a pensioner, you get certain concessions. And that's pretty much what he's talking about with the American healthcare system. If you don't have an income or you're on very low income, then you do get some concessions towards getting healthcare. Although most people in that group don't even know that they can get it. They think that they've just got no cover. So even though that exists for the lower socio-economic group, many people in that group in the US don't ever get to claim on any of those sort of systems. They just go without healthcare. And the pensioners, those that are retired, that are no longer working, they've been looked after. But what about all of those people in the middle? Because really that's the main crux of most of our societies, the main working force of the country. That's the population that isn't really covered in America. That's the main population that has to provide healthcare for themselves through private insurance.
But then there's also these safety net hospitals, like the ones that are training doctors. People think of the US as being a private healthcare system, but we actually already kind of have a model similar to the UK in that we have county hospitals and we have community hospitals, and the county hospitals are funded by the cities themselves, sometimes the states themselves. And people are charged there, but as long as they're below a certain threshold of income and meet whatever kind of like random red tape requirements, then most, if not all, of their hospital costs and their outpatient costs and their prescriptions are paid for by the city. So people say, don't socialize medicine. Well, it kind of already is. And it's out of necessity because we can't just let people die on the streets, We can't do that. We have what are we? Like the highest, for how many decades have we had the highest GDP? I don't even know. Decades upon decades upon decades, right? So knowing that, somewhere inside of our capitalist brains, we're like, maybe we should help these people out. And that's cool. I'm really happy about that. But the problem is that we're only helping out this small portion of our society, which we should keep doing that. Absolutely. I'm a firm believer in being able to provide healthcare at reasonable costs of high quality to everyone. So I'm glad that we're getting that small percentage. But what about the middle class? Should we just not feel bad for the middle class because they have a certain line on their tax return that looks good? It's like, oh, look, they made $100,000. They're killing it. They don't need any help.
And to be clear, in both the US and the UK and most of Europe, people that kind of class themselves and that economically fall into the middle class category is the largest portion of the society, the bulk of society. Most people in your country fit one way or another into that middle class type category, or at least as far as these insurance systems go, as far as the healthcare system and the groups that he's talking about. Easily 2/3 of the main kind of population are going to be fitting into that sort of category.
but then you add up the costs of car payments and, their any sort of utilities and their rent or their mortgage, and then private school, because some of the public schools are horrendous in certain areas of the US. And then you say, oh, well, obviously they have health insurance. But that's the thing. There are a ton of middle-class families, including a lot of people that I know, that don't have health insurance because they can't afford it, or they do these weird health share plans that nobody really understands. It's not really insurance, but you go out there, you receive, certain treatments or procedures, and then you basically go online to your health share community, and you're like, help, this costs a lot of money. And the health share community somehow pays you kind of like an insurance company would pay you back. But people are in this place to where they're just afraid. They're afraid to go to the doctor. They're afraid to go to the hospital, and they should be.
As an idea for what sort of amount insurance will cost you for normal basic health insurance in the US, you're talking around about $600 or $700 on the lower end, and $1,000, maybe a little bit above that, for kind of slightly better insurance. But the average is going to be around about $700 to $800 a month. When you're trying to be kind of economic with it, you're just choosing the most basic one that you can find that's going to cover at least general sort of stuff. Definitely not the best policy, but it's not quite the worst. $800 a month per person. Could you afford that? If you had to suddenly find an extra $1,000 a month, or whatever your equivalent is, do you think you could do that? Or do you think that you would put that money to something more essential, like, I don't know, food, electricity, living?
Because they are very likely to walk away with a $2,000 to $50,000 to $100,000 bill after any sort of encounter with the hospital, whether it's just an ER visit, or it's getting admitted overnight, or they end up in the ICU.
Yeah, that's something we need to be clear about from the outset. If you have a car crash or something, or you do something where you're going to end up in hospital, you're going to need things like an MRI, you've got broken bones and you need that type of treatment, you're going to be charged life-changing amounts of money, thousands and thousands of pounds. Talking about the sort of amount of money that you would expect to earn in an entire lifetime because of one incident, because you crashed your car, because somebody else crashed into you. Yeah, you might be able to sue them afterwards, or you hope the insurances cover it, but most times they don't. And what if you just crash, or you just fall off a ladder, you get out of bed and you twist funny, and you end up pulling your back out? You need to be in hospital for a few weeks. That's going to completely destroy your entire life if you don't have insurance, because the bill is so devastatingly high.
There is no just go to the hospital real quick and go follow up with your primary care doctor the next day. When I worked in New Zealand, I was in New Zealand for 2 months. New Zealand was just an amazing place, an amazing experience. But they all have primary care doctors there. So as an ER doctor, it's your dream, because you see a patient that you may never see again, and they're in a place to where you don't think they have to be admitted to the hospital, but they can actually follow up with their doctor the next day. They have a doctor that takes their phone calls. Here in the US, I talk to people and I'm like, okay, make sure to follow up with your primary care doctor about it. And they're like, yeah, I've been calling him. They don't call me back. I'm like, your doctor doesn't call you back? They're like, yeah. Or a nurse will eventually call back, but then they're like, go to the ER. And I'm not blaming those doctors. I think those doctors are just completely overwhelmed because we just have so few primary.
Yeah, in the UK, you get people going to ER, to the A&E, which is the equivalent of the UK's version of an ER, an emergency room. It's called the A&E, Accident and Emergency. You get people walking in there because they've got a cold, and for really stupid reasons. Well, you imagine it, if you did that in the US, that would cost you $20,000 or $30,000 for that time wasting. Imagine if you go there with something real.
Care doctors in the US, that the ones that are out there whose patients are trying to do the right thing and trying to go see their primary care doctor, just like the system tells them all the time, go see your PCP about this. All those drug commercials, talk to your doctor about who's their doctor. Nobody has one. There's nobody to talk to in the US. And that's why people go to Dr. Google. And that's why
In the UK, if you go to hospital, you need an operation or you've got something wrong with your liver or something like that, whatever doctor you're put under, you will stick with that doctor. You'll always have that doctor. And when you're given an appointment, because you've got to go back in a month's time for more tests, you will again see that doctor. If they need to get in touch with you, they will do. They may well get their secretary to give you a call or send a letter to you rather than getting on the phone themselves. But they will contact you. If you go in for a checkup, they will send the results to you. You don't have to chase them up. They will chase you. They will let you know what you need to know. If you need to just go to your local GP, so not a hospital doctor, the doctor that you get at the local surgery. Most times people have just one doctor. The surgery that I go to is also a training surgery, so they have a lot of doctors coming and going. So it means that you're not that likely to see the same person twice. But they're so efficient at keeping the records that it really doesn't matter. It doesn't really affect you. It's obviously better to have a history with the doctor so that they know you and you know them. But it's not essential. So for your local GP, you might not have that luxury. But with hospitals, you do have that. You will go to see the same doctor.
People choose to, follow naturalistic or holistic methods because it's healthcare that they have access to. The US doesn't have access to the healthcare that they're told that they need. They don't have access to doctors. And that's one of the reasons why doctors online, honestly, I think have such big platforms, is because they become the primary care doctor. They become the doctor that these people actually are able to communicate on a regular basis with, even though it's kind of a one-way street a lot of times like it is right now. By the way, comment below. I'll do my best to answer all your questions as long as it's not personalized medical advice. But man, I'm sorry. I just went off on a rant there. But I have a lot of frustrations with the U.S. healthcare system. And another thing that I want to mention is that doctors and nurses and pharmacists and RTs and even administration in the hospitals, we're there with you. When you think of like big medicine and you think of big pharma, and that's not us. The people at the bedside, we're not just like raking in all these crazy profits. I mean, I make a good living. I'm not saying that I don't get paid enough. I do. But I am not extorting you. My nurses and the pharmacists and the people that you see and interact with are there with you. Not only do we genuinely and sincerely want what's best for you, but we have crappy health insurance too. We're getting raked over the coals too. And we know that something needs to change. Everybody knows that something needs to change. Even the people that are raking in the money. I guarantee you, the executives at these big health insurance companies and some of these hospital systems know this is too good. This isn't going to last forever. But because it's not going to last forever, let's keep turning those profits. And it's so sad because, again, at the end of the day, it's not one company screwing another company to get more money. The general public, the US public, loses every single time. The financial burden falls on the individual every single time. Whether you're seeking out healthcare or not, in your taxes, when you're paying for these county hospitals, you're losing. When you do the right thing and you go to the hospital, you go to see your primary care doctor because you're worried about something and you have a serious illness, you're losing. When you buy a life-saving treatment like an EpiPen, you're losing. And as somebody who truly cares, and you'll hear every med student or every pre-med student say, I went into medicine because I want to help people. And you're like, BS. You're going into medicine because you want to make a lot of money and you want people to look up to you. But the truth is, a lot of those people truly are going into medicine because they want to help people, because they care. If we really were in it for the money, we'd be managing hedge funds. iBanking, whatever the crap that is. NFTs, we'd be making NFTs. If we were in it for the money, we would be making NFTs right now. But instead, we're up at 3 a.m. taking care of somebody with something as serious as anaphylaxis, where their throat is closing up, they can't get oxygen in, they can't get carbon dioxide out, and they have seconds until they die. To somebody who has tooth pain and they can't sleep. We're there because we care. We're there because we want to help those people. I think the general public still sees an us versus them kind of team situation with doctors. And I know this whole vac.
And that's the thing, isn't it? Because if you know that going to the hospital is going to cost you thousands of dollars for just basic treatment, let's assume that you've not had a serious accident, you've not got a lung hanging out or something, you've just got something basic like a broken bone, something very painful that's got to be treated, you've got to go to the hospital for it. But you know the very second you walk through that door, those dollar signs are going to start to roll, and it's going to be into the thousands in no time. You're going to see everybody almost as the enemy, aren't you? Every person you speak to, every bit of treatment is going to be more and more money. Every time they suggest something to you, you're going to be thinking, well, how much is that going to cost me? How many years is that going to cost me? An x-ray, that's going to take me 5 years to pay off that. Do I really need that x-ray? Wouldn't the bone just heal on its own? I know my arm's pointing the other way, but can I really afford to spend the next decade trying to pay that bill off? That's private healthcare. That's the US system versus the UK NHS, where people are walking into the ER, into A&E, with a cold. Or walking in because they have broken a bone, or phoning 999 because they're having a heart attack, or because they're drunk and fell down in the street, and they want an ambulance to come and pick them up. That's the difference between the US and the UK healthcare. And I think it's called humanity. Humanity.
Let's not even go there right now. But it's not us versus them. It's us together. We care. As burnt out as we are, and as deep as the circles under my eyes are, from doing so many damn overnights that are probably limiting my lifespan. I'm probably going to live less because of the overnights that I do. Increase my risk for cancer, etc., etc. Feel jet lagged all the time. All the time. But I do it because I care. I do it because I genuinely want what's best for my patients. And if you talk, you genuinely discuss these things with other healthcare providers that are at the bedside, they're on your team. We're on the same team. We know that something has to change. We just don't know what. But when things get to a head, which they're already there, I'm surprised that there haven't been more drastic changes in US healthcare. But it's going to keep going. It's going to keep ramping up. It's going to get to a boiling point. And we're going to be on your side when it does. Back to that light, cheery video I'm supposed to watch. Oh, it's the fridge girl. Well, the fridge.
For me, it's more like just hives and shortness of breath. So it wouldn't be like an immediate death situation, but like, so I've been fortunate I've not had to use it, but it's something like keep on me. Like I have my backpack right now, I have it on me.
Cost of childbirth.
Jesus. 50 grand, something ridiculous now?
Yes, yeah, I've blown the figures up in your head now, haven't I?
He gets it now.
The highest generally speaking is about 30 grand.
Okay.
Is that reasonable? You haven't
not reasonable at all. It's just like now on like a benchmark.
100, 200?
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
So to have a baby, to give birth in a hospital, $10,000. If you're in the UK and you become pregnant, the last thing on your mind is, this is going to cost me 10 grand. Maybe in the US, the last thing on your mind is, this is going to cost me 10 grand. But somewhere along the line, that is going to be the thought that you have to face. That's why so many in the US have home births. Because it's $10,000 to have your baby to give birth in a hospital. $10,000 to give birth in a hospital in a civilized Western country. $10,000 just to give birth to your baby. When did we reach a world where somebody turns around and looks at how much money they can make out of you because you need to give birth to your baby? And then they stretch that figure as far as they can, all the way up to at least 10 grand. Just for you to give birth. That's for you to give birth, that's it. So you're beginning your life with your newborn and a $10,000 bill. All of the stuff that you wanted to buy your child, where are you going to get the money from that from? Yeah, you're talking about middle class families for insurances and stuff. Most of them don't have insurances, and when they do, that takes all of their money. And they're probably going to have to pay at least half of that 10 grand cash themselves. Even if that's assuming that the insurance did cover some of it. If the insurance covers it, it'll cover about half of it. So they've still got to pay at least 5 grand. If they've got the insurance, and if they have got insurance, they're paying out £800 or £900 a month anyway. 10 grand to have a baby. And it gets worse, because in the US, if you want to hold your child after giving birth, they will charge you again. Now, you heard that right. When you give birth, you just that second give birth to your baby. If you, as the mom or the dad, want to actually hold that baby, I think they call it skin on skin or something like that, but if you physically want to hold your baby, they will charge you even more money. That's the American healthcare system. And that's what our government, or members in our government in the UK, would like people in the UK to change to, instead of the NHS. That's what they want to do to you.
Yeah, I think I paid something like 8 grand to have a child. And that's me in healthcare. That's me like working the system like, ooh, baby, like, look at this awesome deal I got for our family,
The average
honey.
is about $10,000.
God.
That's mad. Oh, no thanks.
Okay, no thanks. In which case, the coil, IUD, contraception, how much do you think that costs?
For one person to implant $1,000?
Yeah, a little bit higher.
Really?
Yeah, $1,300.
To put that in, it's a really simple procedure. Sorry, OBGYN, I don't mean to rat you out, but that's really easy to do.
Calling an ambulance out to your location is in America.
I guess it depends on like where you live. It really does. Is there a price for that?
Yes,
Jeez,
Oh, that's so cute that he thinks that something's free in the US.
$2,500.
For what? Why?
I don't even hear the price.
Why?
Give birth by C-section, and you would like to hold your baby after you've given birth to it.
Actually, yeah, that's what you do. Yeah, you have to pay to do that.
Yes.
To hold my own child that I've been carrying.
Wait,
inside of
what? That's like on an itemized breakdown of charges? Is like, this is what you have to pay to hold your baby?
me. Jeez.
It's not actually that expensive.
Right.
That's
Charging me,
disgusting.
I'm gonna punch you.
That's so disgusting.
Not you, but the doctor. Like $100.
$40.
$40.
Or skin on
Skin on
contact.
skin.
$40 to hold your own baby. So you've just given birth in a hospital. You've already paid 8 or 10 grand or however much it cost you to get to that point, just to physically give birth to your child. And then you want to hold your own child, and the hospital turn around and say, oh, that's fine. If you give me another $40, I'll let you do that. For $40 more, for a few more bucks, I'll let you hold your own baby that you've just given birth to. Just given birth to your baby, you want to hold your own baby, and they say that's fine if you pay me more money. That is just horrific, that is.
I can't
What do you think of the
believe
NHS?
that they tried
Literally,
to
because
make
they
a
keep
profit
doing
off of that.
Literally.
For skin-to-skin
Literally.
contact,
People are so
they're charging
desperate to take
$40.
advantage of it, and I don't want it to change.
Fine, does it make you grateful for the NHS?
Absolutely, absolutely. I mean, I didn't know how much free healthcare we got like just off the bat, but like knowing you have to pay like 30 grand for a child, it's outrageous. It really is ridiculous. So, thank you NHS for your hard work.
I'm genuinely speechless.
Presumably you had an idea that healthcare was expensive in the US.
I didn't realise how expensive. Yeah, I'm just like, What? If you don't have money.
And let's also think about the private healthcare system itself. It is confusing for people in the UK to kind of work out what private healthcare system really is in the US, because we also have private healthcare in the UK. But when you have that in the UK, you have everything that's within the NHS and then things on top. So it helps you cut waiting lists. It helps you get a private room on your own, to have a fridge in your room, things like that. So you're going for like the deluxe package. The NHS is the basic package, and then you get the deluxe package by having your own private health insurance. In the US, the basic package, the basic health insurance, that's like half of the NHS, because most times they don't pay out. When they do pay out, they'll only pay out half of what the charge is. And that's assuming that you had the money to actually have healthcare insurance in the first place, which most people just don't. Private healthcare, the meaning of it to somebody in the UK is something completely different to the meaning of private healthcare to someone in the US. Because of that, we think of a deluxe service, and that's what you would think that you'd be getting in the US with your private healthcare, but it's just not that at all. It's a completely different thing altogether. They might share the same name, but that's the only similarity.
Money, you're fudged.
It's
Yeah.
the fridge girl.
What do you think of the people who are
Just
profiting
wants to
off
say the
sale
F word
of
so
these?
badly.
You're bastards. Sorry, beep. I think they should be stopped. Fuck Trump.
She dropped the F-bomb! I'm so proud of you! She got to do it! What, the fridge? Yo, fudged. Oh my gosh, I love it. So I'm so glad that that video was shared with me. I mean, one, I just love hearing British accents. And two, it's really cute. It's cute and innocent to see people view the healthcare system as reasonable. How cute! It's not here. No. And everybody at the bedside, I kind of did a little bit of a rant earlier, but everybody at the bedside feels guilty most of the time, honestly. Because we know everything that we're doing is going to be charged to this crazy degree, you know? And it makes me second guess procedures that I know that I need to do for a patient. It makes me be like, do I really have to do this procedure? And I mean, the answer is yes. Because I have an instinct now, I have a gestalt now after I've been in emergency rooms for 8 years. And so I know when I need to do a procedure. But there is this little part of my brain that's like, ooh, but they're going to have to pay a lot of money for that. And that shouldn't even come in my brain. As an ER doctor, I should know that I am providing life-saving, or at least just things that will significantly improve people's lives in the moment, like that dental pain that comes in the middle of the night. And I should be able to know that the correct decision medically is also the correct decision for them financially. There's like this struggle in my brain that I always have. Anytime I order anything, it's like, oh man, that's gonna hurt them. And we should just be liberated to just...
So all of the pressures that an AR doctor has, trying to save people's lives, or at least trying to make them feel better than they currently do, one of the first things he has to mentally grapple with is, how much is this going to cost them? Because I know that if I send them for a scan, or if I send them for an x-ray, or if I do this, that, or the other, it's probably going to take them years to pay off the bill. Of all of the pressures that an AR doctor, that any doctor has on a day-to-day basis, trying to treat people, life-saving medicine, or even just the basic toothache, the last thing that they should have to think about is, how much damage am I going to cause to this person's life if I send them for another test, or if I do this treatment or that treatment. They shouldn't have to consider the cost of treatment when working out what the best course of action is for that person. They should be thinking about what's medically best, but they can't, because they know that they could send that person for an x-ray and it might take them 5 or 6 years to pay off the bill from that. They might send them to have a basic blood test just to double check that there's nothing wrong. when they're pretty sure that there's not, but they want to just be absolutely positive, but they know that that could be another couple of grand. A lot of people end up going to hospital because they're having the worst day of their life, because something serious has gone wrong. And if you don't have insurance in the US, that worst day is going to keep on following you probably for the rest of your life, because if you need serious treatment, you will end up with charges that can run into the hundreds of thousands. Even basic treatment can cost tens of thousands of pounds. You have a car crash, you break a couple of bones, you get a few cuts and bruises. In the UK, that would be the end of it. You would be on your way to hospital in a free ambulance to get your free care at your local hospital. You would get checkups afterwards, you'd get all the treatment that you need, and you wouldn't give it a second thought because you pay your national insurance, which I know is a form of paying into a system which then pays for the hospital. But one, you always get the treatment. Two, you get the treatment that you need. No decisions are based on what's economical, it's based on what you need. Because they know that they're not ruining your life by making that choice. And three, the amount that the NHS costs is a lot less per year per person paying in through your wages than a private healthcare insurance. And it's guaranteed to do what it's supposed to do. It does what it says on the side of the tin. In the US, even if you've got full healthcare insurance, there's a fair chance they're not going to pay out for a lot of different treatments, and even when they do, there's such a big amount that you have to pay out yourself that that's going to put you thousands of dollars back before you've even started. And that's assuming that you even have that money. That's assuming that you even have healthcare. A simple accident, falling down a set of steps, falling off a ladder, crashing your car, getting run over, and then the person driving off so you've got nobody to claim from. That sort of thing could put you into literally tens or hundreds of thousands of dollars worth of debt, ruining your entire life. Because it doesn't matter how much you work, how much you earn, you're always going to have such a devastating debt over you that you're always going to be at the bottom of the pile, aren't you? You're never going to get ahead from that. That's the price of private healthcare versus the NHS.
Just focus on doing what's right medically. And I end up having to do that, you know. But there's a guilt there and there's a weight there. And pretty much everybody at the bedside feels that.
They shouldn't have to do that. They shouldn't have to experience that.
This is Dr. J. Max Slaughter signing off. Thanks so much for watching. Subscribe to the channel if you dig it. Follow me on Instagram and TikTok. And let's do this again sometime.
Okay, he's obviously at the end of his video. Like I said earlier, his link is in the description. The difference between the UK healthcare system and the US healthcare system couldn't be more different. In America, a lot of people sit at home until they're that ill that they're almost dead before they would consider seeking medical help, because they know that they're going to incur life-changing bills. In the UK, people are going into A&E because they've got a cold, because they take it for granted so much. If you're one of those people, really don't do that. The NHS is an essential service. You really should treat it with more respect. For those that think that the UK would be better under a privatised system, go and stay in the US for a little while. See how people live with that sort of burden on a daily basis. Knowing that they've got no backup, that they've got no healthcare. And even when they have got healthcare and they're paying out those hundreds of dollars per month, they know it's not likely to cover them for most of the things that they're going to need along the way, unless they suffer with something really serious. And even then, they're probably only going to pay out a portion of it. I'm not saying that any one system is perfect, because obviously there's problems with the NHS. There's waiting lists, there's not enough resources, there's not enough money. But I think that everybody would rather pay an extra 1 or 2% on a national insurance and keep our system than end up like America. What people are living with on a daily basis is outrageous. And what we take for granted in the UK is quite simply extraordinary, even if you don't realise it. What's been your experiences with the different healthcare systems around the world? If you're in a different country, how does yours work? How does it compare to the UK or the US? Have you come across stuff in this video that surprised you? Okay, if you've enjoyed the video, click the thumbs up, and if you haven't subscribed already, please do. Okay, thank you for watching, and see you next time.